COVID-19 not only had a negative impact on the economy and education in the state, but the pandemic has also had an impact on a health crisis the state was already dealing with, opioids. George Godfrey has a look at recent numbers and why health officials are more concerned than ever about addiction in this state.
Isolation and limited access to treatment services are just two reasons the coronavirus pandemic has exacerbated the state's opioid problem. Before COVID-19, South Carolina was dealing with an opioid crisis. Now COVID-19 has created more issues.
With the contributing factors of COVID to unemployment, low incomes, certainly isolation, and supply chain issues, there seems to be a very staggering uptick in the number of people who are reverting back to old habits.
That uptick here in South Carolina is a 50% increase in the number of opioid overdose responses this year compared to 2019. There's also been an increase in areas the Department of Alcohol and Other Drug Abuse Services originally didn't have on their radar.
We saw a hot spot in rural Marlborough County, tiny little town. We also had an issue a couple weeks ago in rural Chester County, very small population. We had never really seen overdose activity there before, and in just a matter of 2 weeks, these places saw a number of overdose responses.
6,500 boxes of Narcan, the overdose reversal drug, have been sent out to help the state respond to the uptick. Counties have also been given money for cell phones to connect patients with treatment and to hold community events to raise awareness.
Drive-by events in these very rural towns where folks could drive by, learn how to reverse an overdose, grab the free Narcan, grab the Deterra bag to destroy the unused medications in their home.
Moving forward, the easiest solution for the state right now is increasing telehealth services and treatment resources to keep patients engaged.
Addiction is a disease of isolation, and certainly that is very true here, as we've seen.
DeOtis expects to have fatality numbers related to opioid overdoses next month. In Columbia, George Godfrey.
A closer breakdown of the increase the state has seen. In 2019, between April and June, the EMS and law enforcement responded to an average of 504 cases, but this year, for the same time period, there has been an average of 852 opioid overdose responses.